Hello. Hi, good morning. My name is Dr. Tofiq Bohra. I'm an oral maxillofacial surgeon and craniofacial and cleft unit head at SL Raheja Hospital of Fortis Associate. Today I come in front of you to talk about a very special topic, which is minimally invasive trauma surgery or facial fracture surgery. When I say about facial fractures, scars on the face are very important to an individual's confidence and the whole overall well-being of the patient. When we consider fractures of the face, performing surgeries or having fractures in the orbit, that is your eye, orbital fractures, then sinus fractures, condylar fractures, all these fractures in traditional style would require opening up the fracture site using incisions on the face and then dealing with the fractures or reducing them, as we say it in our medical terminology. However, with current recent trends, we at SL Raheja and myself having the skills necessary to perform these fractures under arthroscopy, or you can call it as endoscopy. We can put in a camera in these sites and with very small incisions or probably going from inside the mouth, we can deal with these fractures. Let alone adults, when you talk about pediatric facial fractures, this holds much more relevance and importance, because when it comes to a pediatric patient, that is somebody in growing age, these fractures are much more relevant and much more important as they deal with the growth of the baby. When you talk about pediatric fractures, the first thing that comes to mind is that if you were going to open that particular site for putting a plate or reducing that fracture, that would lead to growth inhibition or impaired growth for this baby. And that is a very important factor for which most of the surgeons choose not to intervene at such stages. But with recent advances, as I said, now even in pediatric fractures, we can use these minimally invasive techniques and go in, deal the fracture, reduce it, and in specific cases where the fractures is completely displaced from its original position, you can go and try to fix it using absorbable plates or absorbable suture materials, and this is specific to pediatric patients. It holds a lot of relevance and it is absolutely necessary. Why? Because if you do not reduce these fractures, these babies do undergo surgery. It's not like everything stays normal for them. They have facial asymmetry, they can have bone to bone growth, which is called as ankylosis. A lot of other problems can happen with speech, bite, etc. So dealing with these fractures at the right time with minimum scarring without interrupting growth is something that you can achieve with endoscopic trauma care, minimally invasive fracture reduction, for which we at SL Raheja Hospital are completely capable of with the necessary skills, instruments, because instruments play a very important role over here in minimally invasive surgery as it is man and machine. So that's all for today. Thank you.